Hi there, everyone out there. Bernie Tully, Pittsburgh Attorney, to talk to you today about coronavirus and nursing home deaths specifically. Uh, just read in the paper that there are nationwide over 3,300 deaths from coronavirus just in nursing homes and facilities, and this is an absolute tragedy for everyone that has a loved one in a nursing home. My wife has her mother is in a nursing facility, and it's a real cause for concern for all of us. What's causing it? The answers are pretty self-explanatory. There's a shortage of staff there at the facilities. Staff members are calling off because maybe they have the virus themselves. Maybe a loved one has the virus and they have to stay at home and tend to them, so there's less people, less time to check on patients and to see the symptoms of it. There's not really adequate testing going on to see who has it, who doesn't have it, because unfortunately, or maybe fortunately, you can have coronavirus and be asymptomatic. So people then, staff or anyone else that would be able to go into these facilities that has it, but is not showing signs of it, could be spreading it to everybody else there. Um, there's a couple other reasons, but to me, at least, one of the biggest reasons is just the fact that in the nursing homes, it's in such a confined area, and unlike if you can get outside and walk around, you're in the open air, but there the patients unfortunately are in one confined area, one confined space. Maybe the cleaning of the facilities isn't what it should be, ideally at least. And all those factors come into play on what's causing these deaths. Locally, we saw it in Kane Hospital. The Glen Hazel had several nursing home deaths. Um, Beaver County had the whole facility was shut down. People were calling off, and it was so bad that they shut the whole facility down. Um, it's everywhere really. St. Barnabas, I believe, had some nursing home fatalities from the coronavirus, all from the coronavirus. The fact that a lot of the patients there are vulnerable, elderly, and are very susceptible to a virus, a flu, coronavirus in particular. All those are playing into it. So, what can you do if you have a loved one in there? What can you do? Um, One thing you could do, what they're doing now, is using Zoom to check in with your mom or dad and see how they're doing, observing how are they coming along physically. They look like they're lethargic. They look like they're out of it. There's been a change in their appearance, and if there is, get on the phone immediately to the facility and have them checked out. We just did that with Zoom for my wife's mother, just to see how she's doing. Fortunately, she seems to be doing okay. But that's something that's a practical thing you might be able to do if you have a loved one that's in the nursing facility. Is just be diligent and be calling and be trying to use Zoom where you can do videos just like we see here, and you can actually see mom or dad. So I hope that helps a little bit. Bernie Tully, this is a really tough situation if you have loved ones in these facilities because you're obviously worried, and rightly so. Hope it helps a little bit, and I'll be talking to you. Bye.